All right, so today wanted to talk a little bit about long COVID and what we're seeing in terms of trends in the US and also a study that illustrates what we can do to potentially protect against long COVID. And then we'll end up talking about what's going on in Europe right now. Um, so I think we've talked before about the fact that just looking at hospitalizations and deaths is not necessarily the only impact that COVID is having on our communities and our people. Long COVID is a huge problem that we'll discuss, but there are things that we can do to reduce the incidence of long COVID. And this was a study that came out a couple of months ago, but I think was uh, did a really good job at highlighting the relationship between vaccination and long COVID. As we've talked about, these types of studies are often difficult to do. So finding a study that was done well is really helpful. So this study was published in JAMA. It is a study of Italian healthcare workers between March of 2020 and April 2022. So a 2 year span. So looking at the multiple different COVID waves, essentially the first big three in the spring of 2020 and the winter of 2020-21, and then the winter wave of Delta and Omicron just this last winter, and looking at long COVID incidents from that. So it was a prospective observational cohort study, which is great. That's a much better design. That means we're picking up people at the beginning and following them through. So there's much less chance of introducing bias. It was a relatively large study, over 2,500. You can see there from 9 different hospitals. They were testing these folks prospectively every 1 to 2 weeks with PCR. So that means just about every case of COVID was probably detected. And so they counted those asymptomatic infections too, which is something that obviously retrospective studies can't do. The definition they used for long COVID was symptoms greater than 4 weeks. Again, some people use 6 weeks, some people use 3 months. These different definitions of long COVID are one of the reasons why it's been so difficult to characterize. Nevertheless, we'll take what definition they used and go forward. So out of those 2,500 or so, again, over the course of these first 3 waves, they had over 740 cases of diagnosed COVID, and roughly 30%, 31% at some point had long COVID associated with that infection. That is around what we see in a lot of other studies, right? A lot of studies are somewhere between a quarter and a third of folks who experience acute COVID infection end up getting some form of long COVID. You can see some of the other baseline demographics there, but we've really covered the important stuff. So here's the kicker, though, is when they looked at the association of long COVID and your risk of getting long COVID, there was a very strong association negatively with the number of vaccine doses you'd received. So that if you had received only one dose, your risk of getting long COVID went down only a little bit. You can see there 0.86 was the odds ratio. But if you had received 3 doses of vaccine, your risk or odds of getting long COVID were reduced significantly. You can see there that your odds were only 0.16 or 16% of the odds of getting COVID if you hadn't been vaccinated. So a very strong association between vaccine doses and reduced risk of getting long COVID. And that seemed to have a dose effect as well. So your odds got lower the more doses of vaccine you'd receive. So this is one of the better studies that we've seen that really is able to strongly correlate vaccination and being up to date on vaccination, right, with a reduced risk of COVID. Now, obviously, in Italy and at the time they had done the study, 4th dose was not being used in younger adults as were part of this study. But you can imagine that odds or that association probably continues. So again, being up to date on your vaccines dramatically reduces your odds of getting long COVID, and that is a huge problem here in the U.S. So the second study I want to highlight is one that's really an ongoing study that's run by the CDC's National Center for Health Statistics and also the US Census Bureau. So they combined to do this household pulse survey that looks at multiple different conditions outside of COVID, but they added COVID to this existing survey system here to be able to get better idea of what's going on with long COVID across the US. So this is a nationwide survey that samples, in a scientific way across all different populations and demographics to try and get an accurate snapshot of the US population. And you can see that the sample surveys that go out are pretty large, varying between essentially 45 and 65,000 people sampled within a couple of weeks span when they do these surveys. So again, pretty large study, very well designed, and gives as good of a snapshot of the U.S. population as we can get. And so what you see here is the population adjusted number of people who've ever experienced COVID, right? So looking at a percentage of all adults who've ever experienced COVID, you can see that for a number of states, that number is greater than 15% have experienced long COVID. And again, that's kind of what a lot of the studies are showing. Again, you're around a fifth instead of a fourth or a third, but it's somewhere bracketed in that area in terms of the risk of experiencing long COVID. You can see that the percentage of adults who've experienced long COVID is concentrated in states in the middle of the country and in the southeast, and that's where we've had the highest rates of COVID infection across the duration of the pandemic. So not surprising there, it correlates pretty closely with the areas of the country that have had lots of people get COVID. So the more people that get COVID in your state, the more likely it is that people will have experienced long COVID. And you can see the Northeast, New England, and the Mid-Atlantic states with the lowest rates of folks are the ones that have had the lowest rates of long COVID there. So over time, this does not seem to be diminishing. This is people who are currently experiencing long COVID, and you can see that those numbers are still relatively high. Interestingly, or maybe not interestingly, because the rate of vaccination is so much higher in the older population above the age of 60, you can see that there's a dramatically reduced rate of COVID in that population compared to younger populations where you have a much higher incidence of COVID. So those are populations that are more likely to experience infection and obviously have a much lower rate of vaccination. Now, when you look across the entire US, on average, the number of adults who've experienced long COVID seems to be around 15%. And again, this survey, different from the Italian study we just saw, counted long COVID as any symptoms lasting 3 months or longer. So the bar is considerably higher for this, which is, again, probably why the percentages, instead of 30%, we're seeing about half of that at 15%, as we did at 30% in the Italian study. So that means that about 38 million Americans have experienced symptoms lasting 3 months or greater after a COVID infection. So these are often symptoms that are debilitating, that dramatically affect people's ability to go back to work, dramatically affect people's ability to function within their families. Right? This is a huge impact. If you think about 38 million people over the course of the pandemic have experienced it. It's even more dramatic, I think, when you look at how many people are currently experiencing long COVID, right? So that in August was about 7.5%. So that's almost 20 million Americans currently living with long COVID. And so think of the impact that that has on communities and on society. And again, these are almost all young adults who are working age. You can see there the incidence is much, much lower, or the prevalence is much, much lower as you get into your upper 60s and over the age of 70. And those are obviously people who are generally not in the workforce, but these are the breadwinners of American families. And you can see that roughly 20 million of them are currently experiencing long COVID. That's a huge number, right? And we don't think about that, and people don't, I think, report on that or calculate that when they're looking at what's the current impact of COVID in communities. We only think about, well, we're having about 400 deaths a day, which is tragic, but that is in some ways the tip of the iceberg. And the true burden of COVID is really this. And that translates into economic cost. So this is a recent paper that was published a few months ago by the Harvard economist. This guy's a pretty famous economist, actually, and he had looked at the costs of COVID over the course of the pandemic and actually had published a previous article with Larry Summers, a previous Secretary of the Treasury, and looked at translating that into economic terms, that people with long COVID were frequently out of the workforce. The majority of them worked few hours, and then had a big impact on how many people were able to work in the workforce and be productive. And so this previous analysis that they'd done in October of 2020, the author thought was probably still a relatively accurate estimate of the economic cost of just long COVID on the economy over the year, and that estimate was about $2.6 trillion. So that's a pretty sizable chunk of our economy in the U.S. And so this was the original calculation that they did back in late 2020. You can see that in addition to the $2.6 trillion related to long COVID, long-term health impairment, the overall cost impact of the pandemic at that time was estimated to be probably $16 trillion. That's a pretty big number, right? So there's a lot that's going into the continuing impact of the pandemic and what it's doing to our economy and society. So the last thing I want to point out is we're starting to see now the initial trends of what I anticipate is going to be the fall and winter epidemic surge that we have seen in the past 2 years of the pandemic, the first 2 years of the pandemic, and now as we're going into year 3, appears that we're going to see again. So data from the United Kingdom and this Great Britain seems to indicate that trends now are starting to significantly increase for school-age children and young adults. This has been the past 2 years the harbinger of the fall wave, that school-age children in school environments and again, young adults, those in college, and those in the workforce, often in environments where it is more conducive to transmission and more social engagement of those ages. They are the first group in the population to start seeing increased rates of COVID. And that's what we're seeing now over the last couple of weeks in the UK. If you look at other places in the European Union, rates are dramatically increasing already. And this is for the entire population, not just for young people. So you can see that Germany, France, Italy, Austria, essentially it's more Northern European countries, and Italy, I believe, is being driven from Northern Italy. So we're starting to see a significant upturn in case counts. And again, this looks like the start of another major epidemic wave. As we've seen in the last 2 years, Europe tends to be leading the US in these epidemic waves, usually by several weeks. So I think this is a harbinger of things to come here, that in the next few weeks, we can anticipate our initiation of our epidemic wave. And how high that gets, I think right now is, anybody's guess, but based on things we've talked about before, the relatively low rate of recent vaccinations among the US, the low uptake in boosters, we are going to see, I think, an epidemic wave similar to what we saw at least with the Delta wave last year, if not larger, even similar with the Omicron wave and hospitalizations and deaths that are commensurate with that. So that's what we're looking at. And I'll stop there.